that unpredictability of not knowing when you're going to get called, not knowing what situation you're going to be asked to manage, that in of itself is stressful. And then as you get older, of course, staying up in the, it seems fun and exciting when you're 20 and 30 to be up all night taking care of trauma. But, then I have a full day of work or a full day of surgery the next day.
The Job Guppy podcast is on a mission to help career explorers and job seekers find out from real people what a specific career or job is really like on a day-to-day basis. Join me, your host, Chris Hodges, as we dive in and explore jobs with each guest. You'll hear from experienced working professionals with transparent, realistic, and job-specific insight about the daily roles and their career journey. We go on to explore other topics like job search recommendations and income and salaries. You'll hear answers to questions like, do I need to go to college for this job? How much college? What is your work-life balance like? What do you like or dislike, or what would you do different? And if you don't like what you hear about one job role, we discuss alternative job titles to explore related to the same industry. And my favorite part is the end, where the guest shares their inspirational insight and recommendations for the next person wanting to get started on their career journey. Our guest today is Dr. Mary Beecham. Dr. Beecham is an otorhinolaryngologist. Otorhinolaryngologists are also known as ear, nose, and throat doctors, or ENT physicians. She is the department chair at Harbin Clinic located in Georgia, and in addition to being a general ear, nose, and throat physician, she is also a head and neck surgeon. In her words, she takes care of anything above the shoulders other than the eyeballs and the brain. She graduated from Louisiana State University Honors College with a bachelor's degree in zoology. She has her medical doctorate from Louisiana State University in New Orleans, Louisiana, and she completed her otolaryngology surgical residency at Loyola University in Chicago. She started out studying marine zoology, the study of mammals in water and wildlife. During the interview, she discusses the factors that made her change to a career in medicine instead. We go over her daily routines, how she splits her time between office appointments, bedside visits, administrative work, surgery schedules, the kinds of surgeries she performs, and ongoing education. She outlines her educational and career path, how competitive it can be to get into the medical programs, her recommendations to someone new just getting involved in medicine, and recommendations for job searches. In her parting words, she shares her perspective on being a female surgeon and a working mother of 3 and encourages anyone considering it that it is possible to have both a career in medicine and a family. One of the things I learned during the interview is it can be best to seek out board-certified doctors when looking for medical experts because they hold themselves to a higher standard of review and continued education among their peers. How are you today, Dr. Mary?
I'm good. Thanks for having me today. I appreciate you giving me the opportunity to tell people a little bit about how I got to where I am today and what I do in a regular day of my life.
Is there anything you would like to add to the title, the introduction I gave, anything in particular outside of that?
If you want to put it in layman's terms, I'm basically an ear, nose, and throat physician and surgeon. I usually tell people I take care of anything above the shoulders that's not the eyeball or the brain.
Above the shoulders, not the eyeball, not the brain. All right. Oh, side note, that otorhinolaryngologist, yes, I did practice that. And it turns out that's pretty common because there's actually a pretty good bit of YouTube videos on exactly how to pronounce it, which I thought was funny. Anyhow, getting back to
meaning ear, rhino meaning nose, laryngologist meaning larynx or throat. So that's where you get otorhinolaryngologist, the study of ear, nose, and throat.
Thank you for that. That actually helps with the pronunciation. So jumping into what you do every day, how would you break down what you do? Kind of, if you were to break it down, is it repetitive every day? How do you start your morning, afternoons? How do you wind a day down? How does a week, cycles, interactions with people?
I would tell you a typical week looks like I do a full day of seeing patients, around 40 to 45 patients all day on Monday and all day on Wednesday. And then on Tuesdays and Thursdays, I start my day early in the operating room and do surgery at 2 different hospitals. And then oftentimes when I'm done with surgery around noon or 1, I'm driving to a satellite clinic about 30 minutes away to see about 20 patients in the afternoons. And then on Fridays, which is today, I sometimes do larger operations with my partners for cancer or just more difficult operations. We usually operate together on Fridays, or sometimes when I'm on call, which is at least once a month, I do a morning clinic that is only new patients. So a typical day usually starts for me around 5:30 or 6 in the morning. I think mental health in physicians is very important, so I do try and exercise before I get my day going. I do have 3 children, so another important part of my job is being a parent. So after I exercise, I'm usually trying to get my teenagers out the door safely, and then I head on to work. And at the end of my day, I'm typically going to after-school events. My children are very active in after-school sports, and sometimes it's going to an event or coming home to cook dinner. I do try and provide dinner at home and not eating out at least 3 times a week, because I think that's important for us to connect as a family and also to provide healthy food to my children. So it's usually a pretty busy day, starting at 5:30. I'm usually finishing my day around 8 or 9 o'clock in the evenings, and I head to bed.
Yeah, that's pretty awesome. I like to hear the priorities are pretty well balanced, because one of the questions I like to talk about is work-life balance. What does your field allot for that? And do you have to make that happen, or do you not get a choice? And it sounds like whether you get a choice or not, you've made some priorities there and it works for you and you've made it work.
I think as a career mom, as I like to call my or a physician mom, there's a whole group of physician moms out there, but I think you have to be your own advocate. I think that my schedule has changed. My kids are teenagers now. When my children were infants or younger, I typically went to work a little bit later because I wanted to spend time with them in the mornings. And I typically took a 2-hour lunch so I could pick them up from preschool. So my schedule has evolved over time whenever we've been in different stages of life. I would say that my current situation with my job has allowed me the autonomy to change my schedule as long as I'm providing good access for my patients and covering my costs. Then I have a certain amount of autonomy with how my schedule goes, which I enjoy and has allowed me to be a very involved parent and physician surgeon.
Glad to hear that. In your daily activities, so you work with patients, you work directly with patients, you're meeting them, I guess, just kind of in a room consulting, you're at the operating table at some points. Is that fair to say?
So I would say typically I am a general ear, nose, and throat physician. So there are some people in my specialty that are more specialized, like there are certain ear, nose, and throat physicians that only do ear surgery and ear patients or only do nasal or sinus, and those people typically spend an extra year or 2 of training. I see infants from 1-day-olds to adults aged 100, and I take care of a bunch of variety of diseases in the ear, nose, and throat. So I can go in one room and be telling a patient they have cancer, to another room seeing a newborn baby who's having trouble feeding and needs their tongue tie addressed. So what I like about my job is I have a good variety of patients. I see males, I see females, I see babies, I see adults, and every room brings a different problem. So it's really not monotonous. It is somewhat challenging to have that wealth of anatomy and disease understanding to shift from the ear to the throat to cancer in the head and neck. So that is why I chose the field that I'm in, because I do get a portion of my practice is similar to primary care, where I establish a relationship with patients and I see them over, their lifetime. But then there's a portion of my practice where I see people, I do a surgery on them, and then I probably won't see them again until they have a new problem. So my 8 to 5 clinic is really engaging with about 15 to 17 new patients, and then the rest would be established patients. Within my office, I run a allergy practice where we do allergy testing and take care of patients' seasonal and year-round allergies, in addition to a hearing center where we offer patients hearing testing and we sell hearing aids. So we're a comprehensive clinic where we take care of patients' needs as far as ENT, allergy, and hearing or audiology. On my operating days, typically I'm doing anywhere from 5 to 10 surgeries in the morning. A lot of them are quicker surgeries, like little kids who need ear tubes or their tonsils out, sometimes doing nasal or sinus surgery. And like I said, the bigger operations like taking someone's thyroid out or head and neck cancer or saliva gland surgery, we typically do those on Fridays with my partners.
And so is the otorhinolaryngologist, is that specific to what you do? Are there different levels of that? Like you mentioned, somebody can go for another year. Would they still be called? How would somebody select specific to you? Like if they said, I want to do exactly what Dr. Mary does, Dr. Beacham.
So if you're talking about how I got to where I am, I'll kind of go through that. I went to college and the first class I took the summer after high school was biology, and I loved it. It was a great class. I didn't have any idea that I wanted to major in sciences when I went to college, but that first class was really engaging. So I decided to major in marine zoology, or the study of mammals in the water and wildlife. So I went to LSU Honors College, and that was my major. I was on that career path for at least 2.5 to almost 3 years of my college career. I did bench research on juvenile blue crabs and stingrays. And what I found is that career path to me was lacking in human interaction. I spent a lot of hours in the lab doing research. I enjoyed the people that I was with. It was academically challenging, but I was really missing something and started to look into medicine. And what I did was what I recommend to all college students or even high school students who are thinking about a career path is spend time with people in a career that you think you may want to do. So I started spending time on my holidays or, on a day off with different physicians. And I made the decision that I wanted to go to medical school. So that was really a shift from what I was studying. And so then I wasn't really able to kind of do a free internship because I had to pay for a lot of my expenses. So I went and got a job at the hospital where I was an EKG technician and I worked nights. And that way I got a lot of hands-on patient experience, but I could also get paid. So that was one of many jobs that I worked during college, but that was the one that really got me in the hospital, seeing patients, doing a skill. And there are certain things that you can do as a kind of a step to a career in medicine. You could be an EKG tech, you could be a phlebotomist, I know people who are wanting to go to PA school or medical school, trying to find ways to get their hands on patients. Another good path would be to become a medical scribe. So after college, I graduated and went straight to LSU Medical School, which is 4 years of study, typically with book study and patient contact.
And this is 4 years. This is 4 years after your bachelor's?
Yes.
Yeah. Okay.
So I graduated college a little bit early because I had hours and tested out. So I did about 3.5 years of undergraduate college and then went on to medical school for 4 years. And then during medical school, you pick kind of what you want to go into. And I picked ENT because I wanted to do surgery. I liked the challenging anatomy and I liked the people that were in that career. So you always want to be like, who are going to be your colleagues? And so I really liked the people that were in ENT. They seemed to have a good work-life balance. They seemed to enjoy what they were doing, and it was challenging, and it was a competitive career. When I mean competitive, you had to have, higher board scores and grades in medical school to get into Hernosen, and it is still competitive. So I did 4 years of medical school, and then after that, you do something called your residency, which is usually 1 year of for ENT is usually 1 year of general surgery. So I did a year of general surgery. So heart surgery, neurosurgery, vascular surgery, all different types of surgery. And then I did 4 years of ear, nose, and throat specific training. So that's typically 4 years of college, 4 years of medical school, and 5 years of training. And that will get you to be what I do, which is general ENT. Oftentimes people go beyond that and do something called a fellowship. And that would be if you want to be a specific ear doctor, which is a neuro-otologist, or a throat doctor, which is a laryngologist, or you could be a skull-based surgeon, or rhinologist, which is more nose and sinuses, or you could do another fellowship that is specifically on head and neck cancer.
You covered several questions I had there about how did you get started, your passion, what led you to this, and you got to have some passion there to pursue that so long to get where you want to go. So you covered that, and you answered my question earlier too, like what was your specific title relative to the other titles that work along your peers and specialists and things like that. So that was a good breakdown. What would you say you like, one thing you like the most about your job, or you just one thing you like about your job, and what are your dislikes about your job?
So, I mean, I really think when you're talking about a job with medicine, to me, it's more of a calling or a vocation, because you really are giving the opportunity of taking care of people in their most vulnerable time. You know, you're a trusted provider for people who are entering oftentimes a scary situation. So what I love about my job is patient engagement. I really enjoy taking care of people. That's why I went into medicine. That's, you know, I feel like I was given a gift and an education, and on a day-to-day basis, I always circle back to what brings me joy in my job, and that is patient engagement.
Can I ask real quick there, do you, now that you've been in your career maybe a little while, do you find most of your peers share that sense of a calling? And do you ever come across people where you feel like maybe they don't have that calling and they're not sure why they did it? And how does that work out for them?
So, I mean, of course, the big talk and all the research is burnout, especially with COVID, that, burnout is real because what we do is very stressful. You're put in a lot of life and death situations, not often, but you're making decisions that affect people's life. And the stress can be harrowing if you're not prepared to take care of your mental health. So I think that when people are struggling with burnout, you have to bring them back to why are you in healthcare? And if you're in it for the right reasons, it's very easy to circle back. It is a very rewarding emotionally, but also financially. I do well financially, but I think that if you're only in it for the financial rewards, you're going to have a hard time with the long haul. I'm about 20 years into my career. And if you can't circle back to why you went into healthcare, you're going to have a hard time for the long haul.
Yeah, well said.
Things that I find difficult with my job is there's a lot of growth in administration within healthcare, a lot more regulations. We've transitioned to all this electronic health records, and a lot of the burden of this has fallen on the physician. And so I think that is trying to find ways to help physicians get back to taking care of patients is important. And oftentimes you hear, well, it's just one more click. It's just one more task. It's just one more meeting. But, we can only have so many hours in the day. And what we were trained to do is take care of patients. And that's what we need to be focusing our time on. So I would say the administrative and the computer part is somewhat frustrating. That's why I went and got my physician CP, which is Certified Physician Executive degree, just to kind of get a better idea of where they're coming from and what the needs are in healthcare from an administrative standpoint, and how to maybe help my peers get through this hump. And I would say the hard thing as far as being a mom and a physician surgeon is really sometimes the unpredictability of my job. In addition to my Monday through Friday job, about 8 days a month, I'm on call for several hospitals, including trauma. And so that is unpredictable. I can be cooking dinner and looking at my husband and running out the door to go take care of some sort of life-threatening need. And I get called a moderate amount of times. And that unpredictability of not knowing when you're going to get called not knowing what situation you're going to be asked to manage. That in of itself is stressful. And then as you get older, of course, staying up in the, it seems fun and exciting when you're 20 and 30 to be up all night taking care of trauma. But, then I have a full day of work or a full day of surgery the next day. And oftentimes doing that 4 and 5 days in a row can be taxing. So that breakup, I like routine. And I think sometimes the on-call breaks up my routine. So trying to get back into that, getting up early to exercise, getting back into my routine, that is a challenge I find because I'm tired and, sometimes I need to sleep instead of exercise or do other things. And I just have to know when I'm at my limit.
And that's kind of the hardest time to be motivated is when you're tired. You need some energy to be motivated. And when you're tired is not the time you're finding that energy. But the routine, the habit, not losing that, I think helps a lot in those areas, which sounds like you try to strive for that pretty well. And so do you have to go back and recertify? You mentioned getting, what did you call it? The administration, like that sounded like an add-on.
So that was a choice. That was something that I did extra. It's about 150 hours of leadership and executive and financial and kind of the business of medicine degree. It was through the American Academy of Physician Leaderships, and I did that on my own. But as far as my current career, I do continuing education. I have to have about 40 hours every year or two to maintain certification. I did have to recertify with a board test. So when you get out of residency, you have to do a board exam. I guess I'll start back. When you're in medical school, you have to do 3 different steps of examination to get your medical license. And then once you're done with your residency, you have to take another set of certification, which is people call your boards. And in my specialty, that is a written exam or a computer exam now. And then you have to go before your selected peers to do an oral exam, which can be stressful. So you go on one weekend, they take everybody in the country for an exam and then an oral exam. And then once you pass that, you're considered board certified, which I would always encourage you to seek out board certified physicians because it means that they've been held to the highest standards. And then to maintain that board certification, you have to do your continuing education. And I had to recertify. I did it early at 7 years with another board exam. They have moved away from that. And now I do a certain number of examination questions every year through my organization. And to keep up my education, I do two educational questions every morning that are attached to up-to-date literature. So it's called Dosed Daily. And I usually start my morning wake and do my 2 questions that are attached to a research article. And I do that year round.
2 more questions I want to hit on and just trying to be conscious of time. One would be the associated like academia, like if there's specialty schools that are well known, like 2 or 3 that stand out. And then the other one would be job search. How would somebody start looking, are there certain services or is it just generic Indeed.com type things? But let's start with the colleges. You mentioned you started at LSU to go on into your specialty, I'm not even going to try to remember without looking at the screen. But to go into that specialty, are there just like a small number of institutions that people should seek out if they want to specialize in that? Or is that a kind of they could, wherever they live at across the United States?
So in order to get into my specialty, you do have to have a medical degree. And then what happens during medical school is you interview all across the nation for these programs. It is competitive, so most hospitals only take 2 to 4 new people every year for that 5-year program.
Wow.
And because it is competitive and limited, their job opportunities are all over. So the actual organization has limited the number of training slots in order to not overpopulate people with limited access to jobs. So once you are fully trained through your residency, typically you are looking for what kind of place do you want to live? Do you want to live in a city? Do you want to live in a small town? Do you want to be associated with an academic institution? What kind of career are you looking for? And oftentimes it's who you know and people recommend you for that job. You could use online, but most of the time you're using either your training program reaches out for you or you're using a recruiter. So typically you're not looking for a job yourself. You like if I were to change jobs at this point in my career, it would be reaching out to people I know or using a recruiter.
Okay. So using a recruiter. And are there known recruiter services, or it's just word of mouth, or people associates
I've been in the same job for 17 years, so I don't know what recruiting service. I would say if I was looking for a career change, I would most likely go through colleagues, reaching out to colleagues, finding out who's hiring, what hospitals are looking. My academy, which is the Academy of Otolaryngology, has a job board where there are practices and hospitals with job listings. And that would be the first place I would go after going to colleagues. There's two, there's our certification website and then our Academy of Otolaryngology, which is a great resource for our patients and for people who are looking at a career. It's entnet.org.
Entnet.org. Okay. So that's good to know. It's nationwide because I've talked to some and they're, it's very specific on location based of what they want to do and, how they can grow in certain areas. So this one sounds more nationwide. Now, are there opportunities to hear of traveling nurses and other medical positions where travel can be enticing and fun? Is this one of those kind of job roles?
I would say people would use a traveling job as a doctor more as a bridge than a career move.
Okay.
Like if you're in between jobs and you need to supplement your income, there is something called locum tenens, but really you would want to more establish a place of practice because you're building a patient panel, and it's important when you're a surgeon that you're operating in a familiar setting. It would be difficult to, go to different places every week and establish a new team, but people do it. And I find that most people who do that are in a bridge, or they're just trying to do their last few years of their career, but not as a long-term solution for career path.
Well, that's great. Is there anything you would have done different than how you did do it? Like recommendations to pass to the next Dr. Mary Beacham?
Well, some days it depends on the day of the week. If you caught me in the middle of a really bad trauma call and I'm exhausted, I may say, oh my goodness, this is really hard. Why did I choose this? But if you're catching me on a good day, where I've taken care of a patient and, their cancer has been cured and we're celebrating 5 years, I say, boy, this was a great career path. So I think there's no perfect career. There's no easy job. It is definitely rewarding in many ways. And at this point, I would say I wouldn't have done anything different, but it is not without its hills and valleys. And I'm sure there's more hills to come, especially with a lot of different healthcare mergers that are going on in our current system. There's going to be a lot of mountains, but like I always say, if we circle back to why I chose this career, and that's to take care of people, people will always be sick and they will always need a doctor.
Yeah. I'd probably ask if there's anything else you would like to add. I think we've covered what you do, how you came about to doing it, what your passion is, what drives you. If someone was more interested in looking into this and getting more information, I think we've got things that we can put in the show notes and they'll get out of this. So I think we've covered a lot of information here. And I hope someone.
I guess I would add one thing. I think oftentimes unique to my situation as being a woman surgeon, that a lot of times people think they can't do what I do and have a family. And I would say and encourage people that you can have a family, you can be involved in your children's lives. It just takes a lot of planning and it takes a village. And I have a great village with my husband and my friends in town that really help me do what I do. But I would encourage any females that are interested in a procedural career, a healthcare career, that they don't think that they can't do it if they want to have a family, because you can do both.
I like it. That's pretty awesome and powerful. I'm glad you shared that too. That may push some people over the edge to do something good that they maybe didn't think they could without kind of hearing those words of inspiration. So thank you very much, Dr. Beacham.
You're welcome. Thanks for having me. I really appreciate the opportunity to talk about what I do and maybe push other people into a healthcare career. There's a lot of negative feelings around healthcare right now, I feel, and I still think it's a very valid and rewarding profession. So I would encourage people to seek that career out.
Maybe a follow-up videos in order on ways to go about doing that and helping the next generation, the ones starting off, approach it. It sounds like a good forum kind of discussion. Like probably a whole nother episode.
Yes.
Well, thank you again, and I look forward to getting this posted.
All right. Thanks, Chris. Have a great day.
If you like what you hear and want to take the next steps in exploring your career after listening to an episode, go to jobguppy.com to see a summary and helpful links to things mentioned during the interview, like industry-specific forums or websites, example job searches, career ladders, and degree programs or trade school recommendations. The hope is you now have more information than you did before from the guest on the podcast to help you move forward with the next steps on your career exploration journey. Tune in each week as Job Guppy continues to explore a million jobs in the sea.